Well, there we go. So welcome to Healing Through Imagination, the role of TTRPGs in pediatric hospital care. For those of you who don't know, a TTRPG is a tabletop role-playing game. And while we just had a really awesome presentation on VR, we're going to dial it back a little bit and move it into a more analog space as gaming technology also sits in this space of collaborative storytelling. So I want to thank you as you have arrived to this presentation that's going to be a little bit more interactive than it's going to be silent, which I can't hear or see you, but I do want you to think about some of these conversation pieces that I bring up. So when we move into Gather Town, it will hopefully prompt some questions. Like Chris said, my name's Alicia Filiolo, and I'm the Director of Education and Training at Geek Therapeutics. We are an accredited continuing education agency that provides evidence-based education by utilizing geek culture and the artifacts it leaves behind to address therapeutic need in all types of medical spaces. I'm a veteran, a dog mom, and the creator of a therapeutic role-playing experience that's utilized by some of the largest veteran service organizations in the country, as well as being taught to clinicians and providers and mental health and medical and subclinical individuals to use collaborative storytelling in their medical places. And I'm also a traumatic brain injury survivor who helped build my own treatment plan through this very modality. So the things we're going to speak about are evidence-based with efficacy, as well as anecdotal work based on my clients and myself and hundreds of thousands of clients around the world. We have 3 learning objectives that we're going to meet today. Those learning objectives are participants, you, the learner, are going to understand, hopefully, the effectiveness of collaborative storytelling in a non-digital space to help bring communication, cooperation, and shared problem solving in your units to help your young people and small children be able to speak a little bit more clearly about what's going on with them in age-appropriate language. You're also hopefully going to learn how collaborative storytelling can help children process their unique experiences on your units, while also being able to facilitate their emotional expressions and coping through what's happening and going on with them through narrative creation and role-playing. And hopefully we'll get to explore how tabletop role-playing games can enhance patient engagement, emotional expression, and the overall mental well-being of the young patients that you're seeing on a day-to-day basis, and hopefully their families, as we learn how to identify specific strategic areas to incorporate TTRPGs into your practices and interventions. As healthcare professionals working with young children, we are often always looking to innovate and find other ways to engage with them in the gaming space, whether it is digital or analog. And it's in hopes to help engage our patients emotionally and cognitively while have a piece in making their treatment experiences more positive or having their anxieties, fears, and frustrations brought down to a more tolerable level. Today, we're going to discuss these narrative-based interventions. As you just discussed, VR-based interventions, the same outcome and treatments come from a more narrative analog space with children who are processing their hospital experiences, as well as helping them build some resilience and foster social emotional growth. A lot of people are here probably thinking, what is a role-playing game? What does role-playing mean? What does Dungeons and Dragons or other tabletop games even mean? And I'm hoping some of you are smiling and able to see, hey, maybe I play one of those games, or I've known my children to play them, or I saw it on TV shows like The Big Bang Theory. Today, we're going to talk about what a role-playing game is. And a role-playing game is a game that is used with story and collaboration and narration that is built from us, you, the facilitator, and your players or player and their families. These games are created with character-driven stories that are often built on a personal experience going on with our young people. And these games have a collaborative root in them that helps individuals understand what's going on inside the game, as well as how the game or the role-playing experience or conversation has impact on what is happening to them in the real world. TTRPGs are not a video game. They are traditionally played with pencil and paper, but for individuals who are seeing clients virtually still prior to coming into the unit for surgeries or post, you can still have these experiences in a virtual space. And tabletop role-playing games are moderated by Game Master or you, the facilitator. And this is an extremely dynamic process in which your participants, whether they be your patient's family, or combined, it contributes to a shared narrative that allows for a co-construction of meaning and emotional exploration in having to figure out why something is happening to them and then experiencing it through a narrative lens to be able to reframe some of that to bring down anxiety, stresses, and fears. In pediatric hospitals, clinics, and units, we see that collaborative storytelling can offer an opportunity for children to help process their hospital experiences by helping them embed their personal emotions and fears and hopes into these fictional narratives that they're creating in hopes of allowing them to be able to have a little bit more autonomy and understanding in their age-appropriate care, and giving them a place to understand why something is happening, what is going to come next, and how they can heal and work through some of those things on the post end. We talk about why collaborative storytelling matters, and collaborative storytelling through the dynamic space of working through something that is real to all of us, and then something that is fictional in a story allows individuals to have this modality that works for pediatric patients who may not have the ability to pinpoint what a emotion is, how they're looking or seeing a scale of faces, and not be able to provide what a clinical person, doctor, or part of their team needs. So we have this storytelling part of care that allows individuals to create this story where Johnny or Sarah can start to pinpoint their own age-appropriate language to a story that helps them fight for a mission or move through an experience that may be a little bit scary for them. I want you all to think about a moment where you had a patient or a client or an individual in any of your pediatric unit rooms who was unable to express themselves with language and didn't have the correct terminology to emote or how to tell you what was going on. And hold on to that for a little bit, because we're going to hopefully bring you to a full circle of understanding that storytelling can help the individual express those emotions a little bit more clearer. In that space of processing and helping through storytelling, emotional processing can be done through metaphor and symbolism. And using metaphors allow children to safely explore difficult emotions by transforming their medical procedures into adventures that then children can reframe their experiences, like going through chemotherapy or a long-term hospitalization stay, as challenges that their character is going through while they're simultaneously going through it, but giving them a little bit of fun and adventure so you, the facilitator, or you, the care specialist, can help them walk through some of those really scary moments. It helps also put some distance between the child and the procedure or what's happening, and it allows them to process their emotions without directly confronting them, because we all know how scary that is. And we learned just a few moments ago that having to process some of these issues going on the unit or in our sessions can be very stressful, and it can heighten all of those fears. And we can move through that without having to directly confront those things, but instead confront them with a story that removes them and us from what's going on, but giving them all the information they need as a story. And symbolism is also a way that offers a therapeutic reframing tool for individuals who work in a clinical space or with the care team on the clinical and mental wellness side. We know that reframing is really important. And if we can turn something that's overwhelming into a fun, approachable, age-appropriate story, we're able to give that child some agency and allow them to navigate what that story could look like. We've had a couple examples here in the last couple months where an individual has gone into an MRI machine and is dreading that, and they begin to deregulate and have some concerns of what this big noisy machine is. And so we had one of our therapeutic game masters who was working through some one-on-one care provide a reframing technique, and they reframed it as the child was going on this magical mission, and they had to go through this portal, and the portal helped them see what was going on the mission, and they could determine what was happening to them as they were trying to figure out what they needed to do next. And it was built in a way that the child was able to see that this MRI machine isn't scary. and that it's able to see the child was able to see that as they moved through it, yes, there was some sound and some clicking, and they had headphones, and it might be a sensory overload, but they could come out and tell their story as the hero who came through this mystical portal on the other end with some information about what was going on with them on any part of their body that they had the MRI. The reframing helps focus the child. It helps reduce anxiety by turning that experience of something that's negative and scary into something that's more powerful and empowering. Just as with the VR system, we're able to see that these ideas of rewiring and reframing what is going on can help reduce anxiety and stress. There's also this sense of collaborative storytelling, providing emotional safety and clinical integration. And that's really hard sometimes to find a way to connect with a young person in spaces that they find to be most exciting. And for everybody, it's not a video game, it's not a television show. For some people, it's a board game, or it's a way to be imaginative and create these stories that kind of remove us from the fear of what's going on. And the role as a facilitator in this space is crucial. We all know that our work is crucial, having to have hard conversations, help children process as long as it is required for them to be in clinic or post clinic, as well as also helping the families navigate some of these things. And as facilitators, we want to ensure that these narratives are helpful and therapeutic. And so in these stories, we provide a safe, supportive space for children where they feel empowered to explore their emotions in a way that they might not have been able to do before. The stories are often flexible, allowing us to guide through a narrative that is focused on what's happening right here and right now with the moment of having to go in for an MRI, and then move them as it is needed through different story pieces that fit the real world experience into a narrative in a fictional space. It also allows the child to have a little bit of control. And oftentimes, children don't have any control over their medical procedures or what's happening. But if we can give them a little bit of control through these narratives that they are constructing, it helps them feel like they are part of their own medical treatment and that they're helping make some of these big decisions of having to go into a machine or having to have chemotherapy and having their port changed or something put onto their body. It helps guide them and allow them to de-stress a little bit in some of the most stressful situations. There is these system theories that Vygotsky and Erickson have that create this process of social cultural theory and stages of play. And oftentimes they're not married and they're not looked at as how they can be constructed together. And collaborative storytelling provides a really amazing scaffolding where children can process complex experiences through social interaction, whether it's with one individual on their team, their entire team coming in to meet with them for the first time and telling stories or asking how they feel about an interaction or moment. And then with the families, which we often don't talk about family care and that continuity. And when we're experiencing collaborative storytelling, it's a really great way to bring the parent into an imaginative play space to help them interact with their child and the condition or interactions that are going on in the facility and take that with them home so they can engage with the healing process on the other side in post. With this alignment of the social cultural theory, Erickson's stages of play also come in, and it helps when we are on pediatric units or in pediatric care establish a sense of mastery and control throughout their stages of play at age appropriate times. And it helps us foster competence and identity in an otherwise powerless clinical environment when it comes to our young people, as we can see that they don't have a lot of agency. And giving these conversation pieces and storytelling areas of being fictional care can help provide some of that at, of course, age appropriate levels. There are 6 key factors in tabletop role-playing games that are enhancing patient engagement that we have seen in adult units, pediatric spaces, both clinically, subclinically, and on a medical surgical side. And when these TTRPGs such as Dungeons and Dragons are offering a structured, flexible framework for their therapeutic engagements, we're seeing that it's facilitating emotional expression and processing that we hadn't seen in the past. It allows the child to be able to interact with terminology that's more age appropriate. It allows them to pinpoint areas that they're scared of, and it gives us a better understanding of what's going on in the mind of our patients versus having to guess all the time. It also gives them a sense of control in their environment where they don't really have a lot of control. It's very sterile, it's often very scary. And like I said earlier, that control is very important when looking at how a child can heal better in a space that they know that they at least have a voice, regardless of their age. We found that it has also encouraged cognitive and social development. We've seen courses in units that stories have been done with groups of individuals who are on a cancer ward and they're all going through the same thing. And they come together and they have a facilitator going through a tabletop game and experiencing conversations with them in a way that wasn't happening prior to this game. And the kids are opening up, they're engaging with others on the floor. And as the engagement on the floor is happening, they're also increasing their engagement with their medical teams, which oftentimes can be really hard. And it's like pulling strings to get children to be able to interact. Through this modality, we're finding that that is changing drastically. We are seeing that it's supporting developmental and appropriate coping mechanisms. And in game, there's not any real consequences. So they can play and experience things that they might not be able to experience on the unit or in the real world. And through that, they're learning how to cope with ideas that could be here on the unit and then go out into the real world and not miss really any beats of growing up or the things they might have missed because time moves so quickly when you're a child. Those things can be experienced in game. And then when they go back into the real world, they're able to cope with some things that they might have missed otherwise. We've also found that it reduces anxiety and provides a sense of escapism in a positive way. And it promotes long-term emotional resilience by teaching lessons in the stories or by giving individuals a little bit more knowledge that's age appropriate for what has happened to them, what might happen at home as they continue to heal. It's really helping build that emotional stability and foundation that is required when some of these young people are struggling for years while they're in and out of hospitals. There is emotional engagement throughout character-driven play all the time. For anybody who's worked in play therapy or has worked on a unit where children are playing with Legos and using other types of art, you see a fluidity and elasticity that happens cognitively that won't or doesn't often happen on other units that aren't engaging in play all the time. And you can see it with adults that healing is a little different when you are able to play versus when you are just stuck in a room. And there is this idea of emotional projection and emotional and empathetic literacy that comes from learning how to engage with other individuals or just a story created by our patients that is character driven and is allowing them to play in all types of spaces that doesn't really require a lot of information or pieces to be able to tell a story. And this is one of the biggest core strengths of tabletop role-playing games in character-driven narratives. It allows children to project aspects of themselves onto their characters and explore emotional landscapes that they might not have ever explored before or been given the opportunity to really understand. I have a couple examples that I've experienced with young people and adolescents that when they are feeling powerless due to their medical condition, it really creates a powerful character-driven narrative that allows them to maybe want to be a little braver and confront obstacles that they might not have wanted to engage with outside of the clinic or outside of this collaborative story. And it gives them a sense of ability to be fearless. And it helps reduce their anxiety knowing that maybe I can do this. And as care specialists who have worked with us and gone through training to learn how to do this, they have found that their patients who may be socially withdrawn are coming into this collaborative storytelling approach through TTRPGs like Dungeons and Dragons, and they're leaving as a little bit more charismatic and they're a little bit more hopeful. And they understand their condition and some processing tools and experiences a little bit better because the story allowed it to hit their minds in a way that made sense to them. Just as VR and video games make sense to a lot of individuals who are drawn into that, collaborative storytelling and the verbal component really helps with emotional literacy and empathy as well. We've talked about problem solving and resilience building and tabletop role-playing games and storytelling with our patients and clients is a rich experience to have cognitive challenges, and it helps our I often think of them as players. And so when we have our patients, when they're playing this game, they don't think as a patient. They begin to think as a player. They begin to think as that character as they become the hero of their story. And it allows them to be critical thinkers in a place that a lot of critical thinking just isn't happening, because why would I critically think about what's happening to me at the doctor's office? But if I can take what's happening at the doctor's office and turn it into a story, then I can start to develop strategies and make decisions that affect the in-story narrative that will hopefully impact me, the child on the outside, that is age appropriate and understanding based on the way the facilitator or the care specialist is guiding stories. It also helps problem solve, and it allows them to continue to flex those muscles when they're in clinic, and being able to take the real life situation and move it into these ideas of play, and how uncertain and complex medical decisions can be very scary. While they're not having to make those decisions, they can at least be aware of what that decision is, and how in their story of going through this magical portal, how they're interacting in that portal, and then allowing them to see the picture of their MRI and showing them that this is what you found on this journey. It gives them some in-game and real-world problem-solving techniques that some children lose while they're in clinic, because that side of our brain is just kind of left out. And we have noticed that when children are engaged in this style of play, they're building adaptability to be able to move through moments when they are told, okay, you're going to go home tomorrow, but then that gets pushed back because of a complication, and now they're having to leave in a week from now. And in game, in this process, they're able to find that resiliency to say, okay, I can do this for a few more days. I can be adaptable. I can use these key coping skills to deal with my treatment and other hospital stays. I did it in game. I can do it now. And it really builds up their self-confidence. The social benefits are remarkable when it comes to how you can use TTRPGs for healing. You can build trust in your medical staff a lot easier. It is inherently a social experience, whether it is with one person, two people, or five people in a group. In a group setting, you have multiple children who can learn how to communicate with one another. And in one-on-one settings, you can have a child who is moving through your unit learn how to have effective communication and tell their staff or their team what's going on a little bit easier as they're learning how to move through these conversation pieces and story. It allows them to then speak more clearly in the office before they move into treatment. We know as providers, whether you work in a hospital unit or you work in a standalone clinic, that children often feel isolated when they are at the hospital. They've lost some of their friends. They may not have experienced school. Some have missed prom. Some have missed big life moments from the ages of 5 to 18. And in that isolation, it can be really challenging. And games like this change what isolation can look like. It allows for individuals to build a social connection with the other individuals around them. And it doesn't matter if it is a clinical team or a support network or mom and dad and a clinical person or a life care specialist. It really brings in a sense of belonging and removing that isolation piece. And it can break the barrier between a doctor and a patient. We see this all the time in clinical work. When an individual comes on for therapy after going through intake, we often know that it can take a really long time to engage with our clients and get them to want to open up with us. But we have shown through anecdotal evidence that an individual who moves into a collaborative storytelling approach for treatment will often open up by the third meeting, whether that's the third 55-minute session or the third 15-minute encounter getting ready for something bigger. By week 3, moment 3, or encounter 3, individuals who are in this process of telling stories and adapting through a story are able to understand, trust, and communicate better with their teams, because story building and telling a story together helps create an atmosphere of trust that in the medical field we all want right away. We really want to connect with our clients and our patients as soon as possible to help them on their healing journey. And collaborative storytelling really does help with that. Playing together as a clinician, a provider, or any multidisciplinary team really helps foster that teamwork and empathy and communication. And it helps children feel like they are part of the team instead of the reason why the team is there. And of course, all of this is age appropriate. And so you can tell stories to a 5-year-old and have the 5-year-old interact, or you can tell stories to an adolescent that is a little bit more age appropriate for the adolescent to engage as well and break down some of those barriers that we often feel like we're still having to move chess pieces to get them to interact. Facilitating a healing journey is really important, and it allows us to see that role playing can be utilized for many, many purposes. We use it for positive reinforcement. We use it to explore emotionally. We have puzzles and encounters that allow us to push through some challenges and have long-term engagement, which oftentimes we teach that it just doesn't end when an individual leaves the hospital. It can continue into other areas of the healing process, and it can continue in with the family. So while you may, as child life specialists, be doing it here on clinic floor or in your units, it can be taken home so easily, and the story can be continued with mom and dad or whomever the child's guardian is through their at-home healing process. And when we allow children to explore these emotions indirectly through this safe space that has no consequences, they can learn to face their fears, express their anger in a way that they might not be able to express it or feel like they can express it to a doctor, and develop empathy for themselves, their team, and their families in ways that oftentimes feel extremely vulnerable in our real lives, but in the game, it feels cathartic. And for you, the individual who may facilitate these, and for any of you who have played a game like Dungeons and Dragons or Vampire the Masquerade or Werewolf or any of these other kittens under the bed, you know that storytelling is a really great way to connect with people. And we can do that clinically with evidence-based treatment models and have our patients or our clients have a better interaction on unit than if we didn't have games, whether it be digital or analog. We also want to build some emotion and engagement with our patients or our players. And when they are patients, there's oftentimes a lot of that fear, anxiety, and stress. And as players, that fear, anxiety, and stress often falls away and comes with joy and endorphins and this want and desire to move through the story with the adult. Because if an adult will play with me, wow, like that's amazing. And we've often found that the children who we have worked with have said, I didn't think adults would ever play like this, because they don't get to experience adults or their care teams getting down and playing on a level that isn't just watching a video game, which is really great. And engaging in video games as well as the player is really great for the mental well-being of understanding these experiences together. There are some challenges that are in this facilitation of healing, and it's often challenges with the adult not able to let their selves be vulnerable and share with silly voices and a silly story. But it does provide the opportunity for children to build upon adults also having this play space, and it allows them to see that even as I grow up, I can continue to play. And especially on pediatric floors, where we want to make sure that they're having as much fun as possible. We find that on pediatric units, we often get like the more lighthearted providers and individuals who know that it can be really scary most of the time, but being more uplifting and then showing them, hey, I want to be imaginative with you too, is really awesome for helping children overcome some of these obstacles, and then seeing adults as funny, friendly individuals. There's also some really practical ways that TTRPGs can be implemented in pediatric care, and it's often done in a interdisciplinary approach. And with the integration of tabletop role-playing games in therapeutic interventions, there is a requirement to collaborate between multiple disciplines. As we look at the full scope of care, we want to make sure that in the storytelling approach that everybody is aware that this modality is being used, and the theory, whichever theory you hold on to, is being used to help tell these stories and help these young people process some of the things that are going on pre-clinic time, during the clinic and hospital stay, and post, because one person may be having a story moment and the other person may also be having a story moment, but those story moments aren't, there's no continuity between those two story moments, and you want the entire team to be aware of what's happening, so the story is continuing for the child and they're not having to continuously try to rebuild the wheel. And that is a really great approach for child life specialists, psychologists, social workers, and the medical staff to be aware of, okay, Johnny is having this big operation. This operation is being talked about as Arthur and the Knights going to find Merlin and have Merlin help calm down the fears by magic, and walking through what that looks like. And it's extremely complementary when the tool is used along the traditional medical route, as well as this collaborative storytelling approach. It's a little bit more holistic, but it allows everybody to see the full picture. And it also allows individuals to have expertise in gaming. If one person on the team has been a TTRPG player for X amount of years, they can help another member of the team possibly guide into a new story or help process a new event that is coming up. And so if this can be done in this interdisciplinary approach, the continuity of care really helps impact how stories are accepted and how the youth are able to process those stories. It's really awesome when you can track emotional and cognitive progress through play. And it's one of my favorite things when you can see an individual's score start to shift. And as we saw in the VR slides, you can see anxiety decreasing. And it's the same with TTRPGs and collaborative storytelling, especially in patients who are undergoing long-term care. The idea of a collaborative story in a TTRPG, it offers a valuable opportunity to have sustained therapeutic engagement through ongoing narratives that are happening between all stages of treatment. And you can see that by building a story that evolves over weeks and months and maybe years of treatment, how the facilitator or the provider can create a sense of continuity in this patient and create stability for the patient each time that they're coming into the clinic, during their clinic stays, and then as they go back home. It helps give them something to look forward to during their hospital stay, as well as getting back into that swing of storytelling with their teams. And we understand that sometimes teams change and that story may change or evolve if a care specialist is moving on, but that also allows to take that skill of understanding empathy and change and being adaptive and flexible as someone leaves their life. It sets them up if you can do that through a story. It also allows for deeper emotional exploration and allows individuals to track that. In that tracking, you can see how the child or the patient is adapting in real life through these narrative processes. You can see that maybe in the beginning they were a little bit more apprehensive. They didn't want to talk. They weren't sharing why they were scared or worried or fearful. And then as week 6 comes along, you can ask, there's an ability to ask some follow-up questions. And you can see that from week 1 to week 6, they're a little bit more charismatic. They're wanting to have a deeper conversation. They're answering your questions a little easier, and they are understanding what could be next and accepting that a little bit easier. You can also look at a child undergoing treatment. They might be too tired to really want to participate in a high energy session. So you can dial it back a little bit and watch that, okay, as I'm tracking what is going on in this progress, I can see that today they're a little bit more down or ejected from the process, and they're a little bit more fearful about the next step in their medical procedure or in their treatment. Let's have a story encounter or experience that is a little bit more uplifting and not the same story that they may have been telling 2 weeks ago. And you can navigate through those things and move them as your patients ebb and flow through their own emotional encounters to allow them to still have moments of storytelling to help them bring down their stress and anxiety. And oftentimes an individual will come in extremely stressed or worried, and once the story process, 15-minute story encounter can really change that anxiety score around 30%. We've seen the numbers move 30 to 35%, and it's been remarkable to see a very high stress situation become a very low stress, manageable situation through storytelling. There also are some advantages in how stories progress and how individuals can see a patient talking to them more clearly. And it allows you to be able to notate how in story the character is getting a little bit more excited, they're a little bit less stressed, they're a little bit more willing to tell why they're angry to the doctor or to their parents in that space than being able to do it out of the space and then turning around and seeing the progress 6 weeks later where now they are able to advocate for themselves. And so it's really amazing that you can see that progress and that cognitive change through seeing these long-term engagements and catching each time that a patient is able to be a little bit better, more active, or a longer self-advocate for themselves in those spaces. You can also track narrative patterns and behavioral cues through these stories and encounters. You can see that a client or a patient who has come into the unit is a little bit down, like we've been speaking about. And in that story time, you can see that progress a little higher, especially if you have time with them that is set aside with more time to play. If you've got 30 minutes, 40 minutes, 50 minutes, or 15 minutes, you can still track those cues to see where things might be a little bit rougher or they might be increasing. You can also be able to recognize for anybody who's doing testing to see the subtle differences in the narrative between the player and the story. And you can see how there's growth on both sides. So marking growth has been a really great way to see how individuals are doing with their care or with just their time on unit, staying at longer stints of hospital time. There's an example that a child who was taking more risks in game was seen as a more engaged individual because they'd come in, they didn't want to tell stories, they didn't want to conversate with anybody, they didn't even want to talk to their team, they just laid down in their bed and were really isolated and dejected. But when they finally started seeing that the story could be fun and they could make up any story that they wanted and not get in trouble because nobody was seen as a lie or a far-fetched story, they were able to notice that the self-confidence was bigger. The patient at the time was able to tell a doctor, I don't like this. I don't like your cold hands. Could you please warm them up before coming to see me? Which was kind of mind-blowing that a patient was able to say, like, that's why I get angry. That's why I don't want to be around you. And it all just came down to cold hands. But they were able to experience how to navigate and advocate for themselves in this TTRPG and then move that into their real world and have that coping skill, which was really amazing because it changed the way they felt isolated and not part of their care. There's other observations that you can see and are used in TTRPGs that help reinforce positive behavior, support where needed, helping parents come and see that these behavioral cues are what might trigger your child at home, and then working through some of those to help the process at home for healing be a little bit easier. There are some requirements for an individual going through this process of wanting to utilize TTRPGs in an applied setting on all units, and it comes from an accredited program. And oftentimes people want to know, where can I learn this? How can this be used? For any of you who are already TTRPG gamers, you can take this and bring it to your unit through evidence-based treatment models that is approved by 4 of the largest licensing bodies in the United States. And it's a 36-hour program that provides live application, as well as pre-recorded lectures. And it helps individuals understand how you can take a story and a game that is analog, break it into 15, 30, and 45-minute increments and move those stories into our units that help our young people process age appropriately through age appropriate storytelling, as well as connect with older adolescents who have seen things like Stranger Things and The Big Bang Theory and the Dungeons and Dragons movie, experience some of those really heroic moments that most people don't know how to engage with or didn't know that they could engage with it and use it in an applied setting for healing. There are a few times of the year that we do storytelling and teach storytelling. And that's a really great way to engage with how you can learn how to effectively take the evidence-based treatment plans and move them into your space. And I want to encourage everybody, as we're learning about games in a tech space, that gaming technology is both digital and analog. And there's a really great set of games that we can find all over the country in big box stores that we can bring in and engage with our young people and our patients to help them kind of remove themselves from what's going on and have them rewrite the narrative or the script through evidence-based processing. And then, excuse me, when you have a client or a patient who leaves the unit and they often want to move and continue through these stories, there are lots of places in the public space that you can find or send your patients to continue to tell these stories with their parents, by themselves, in their schools. A lot of schools today are utilizing TTRPGs and after school programs to help build social emotional learning, because you can do that in many ways. There are public libraries who are conducting weekly events through TTRPGs, specifically Dungeons and Dragons, since most children know about Dungeons and Dragons. There are conventions and bookstores and comic book stores and card game shops that also have age-appropriate themed nights for kids to play. So if you have a patient who wants to go learn and hang out with other kids and they're ready and they've learned some skills with you, you can then move into that space with them and tell them, hey, okay, let's learn to cope. And then we'll put you out into this space and tell mom and dad that there's this local space that you can have, and they are all over the country. And if you're looking for those, if you send me an email after this, I can get you in a list of your local gaming-based and TTRPG-based programs in your local area. And then there is an agency that we have called Reforged Gamer, where we have virtual social emotional skills groups of all levels for adolescents and youth to be able to continue on that journey of telling stories with the hope and the goal of helping them be better prepared for anything that's going on with them medically or in school situations where they may need a little bit more resources and reference guides. And that is how healing through collaborative storytelling can be utilized on our units, on pediatric floors, in pediatric clinics, and in other spaces that we're working with youth.